Welcome to the MedTrainer EMTALA training, Chapter 1. In this chapter, we will provide an overview of the Emergency Medical Treatment and Active Labor Act, along with essential terminology and historical perspectives. The Emergency Medical Treatment and Labor Act, EMTALA, was passed in 1986 under the Consolidated Omnibus Budget Reconciliation Act, COBRA. The intent of this act was to address the problem of patient dumping, which is the denial of care or transfer of patients who have the inability to pay for medical treatment. Prior to this legislation, many uninsured patients were transferred from private to public hospitals, primarily for financial reasons. Today, EMTALA is considered one of the most comprehensive laws that guarantee non-discriminatory access to medical service regardless of a patient's financial situation. The statute is codified under 42 U.S.C. Section 1395 DD, and the provision states that any patient who comes to the emergency department for a medical condition must be provided with an appropriate medical screening examination. If the patient is found to be suffering from an emergency medical condition, the hospital is required to provide treatment until the patient is stable or transfer the patient to another hospital to receive care in conformance with the statute's directives. The provisions of EMTALA apply to all individuals, not just Medicare beneficiaries. The term hospital includes critical access hospitals. The law also defines dedicated emergency department as any department or facility of the hospital that is either licensed by the state as an emergency department or offered to the public as a provider of treatment for emergency medical conditions. The definition dedicated emergency department also includes a facility where at least 1/3 of the visits in the preceding calendar year actually provided treatment for emergency medical conditions on an urgent basis.